Governor John P. DeYoung Jr. has proclaimed May as Mental Health Month. We are encouraging the Virgin Islands to learn more about mental health illnesses and to overcome the stigma associated with mental illness. Studies suggest that 1 in 5 Americans are affected with mental illness, including more than 15 million Americans who are coping with conditions such as anxiety, depression, bipolar disorder, or schizophrenia. Far often, symptoms are ignored due to lack of information, discrimination, perceived stigmas, or fears of treatment. Today on One-on-One, we'll start opening more dialogue regarding the issues of mental health. My guest is Dr. Celia Victor, who is the Director of Clinical Compliance for the Department of Human Services. Welcome, Dr. Victor.
Well, thank you.
Thank you for coming on our show.
Okay.
Now, the governor has proclaimed, of course, May as Mental Illness Month, and we want to create a sense of awareness to our community, because in working with families and children, we realize that that's an issue that's prevalent, but yet often is a silent treatment to this whole thing about mental illness. Can we establish what is it exactly? What is mental health? And then what is what we call a mental illness?
Actually, mental health means well-being.
Okay.
One's ability to cope in one's life and to attain one's goals.
Okay.
Educational goals, going to work. It's kind of like a level of functioning.
Okay.
In terms of mental illness or mental not wellness, means this person is unable to have overall well-being. Mentally, emotional, behavioral states impact their ability to function and to go to school and to go to work and to function on a regular day-to-day function.
Okay. Well, let's talk about the organization that first started this whole proclamation about mental wellness being, the theme for the month or the theme for the year. How did that originate?
Actually, in 1949, the United States saw a trend from individuals going from institutions and hospitals closing down due to economic burden and shifting more to community health centers. And when that happened, people became more aware of what this actually meant. The federal government, Health and Human Services, SAMHSA, which is the Center for Substance Abuse and Health Administration, they guided the United States in looking at mental illness. And every year in the United States, the governor comes out, gives a proclamation to increase the awareness of mental illness.
Okay. All right. I wanted to find out specifically in our community, we have these stigmas, and in talking to parents and in talking to members of our community, they often say, well, I don't want to go down to the mental health building because I'm not crazy. It's that issue of fear, that issue of insecurity, or even wanting to address the fact that a family member has a mental illness. What's your take on that?
I think that's the reason why every year more awareness is put onto this issue, and that's the reason why it's one in 4. Okay. And this is not unique to the Virgin Islands. This is all over the world. Right. Most countries, that is an issue. The issue of stigma, the issue of what does this mean about in terms of my family and my community. We live in the Virgin Islands where the community is much smaller, and because of that, individuals are afraid of being stigmatized. Even those individuals who happen to be actually well and have a good mental state, but because a member of their family may be impaired, then they may be the issue. So individuals are afraid that they are now stigmatized because they may be seen as what, quote unquote, the old term, crazy. Okay. And so we're trying to move away from that concept of quote unquote crazy, and that you are just basically unable to balance your health state, your mental health state.
Well, currently with your clinical background, what are some of the prevalent cases that you see as it relates to mental illness here in our community?
I think in our community there are several cases. You have the women who are actually in the process of delivering a baby, and sometimes they may be at risk for postpartum depression. Okay. A lot of times women may become depressed and even psychotic right before an episode of due to their estrogen and testosterone levels. And that's one case. And then you also have the case where you have teenagers who experiment with alcohol, experiment with marijuana and other substances, and they become impaired via substance abuse, which at times may cause them to be severely depressed, hallucinating, and having other mental health impacts. Okay. So you see that in that aspect. And then you also have the issue of trauma. And you see that with children in foster care, Department of Human Services, where children go from being removed from their parents' home for their inability to provide for them. Right. And because of that, children are placed from a home, and that's one case of trauma. So the more times they're moved from one foster home to another, you increase the cases of trauma. And that's the reason why I feel very excited that this year that that this proclamation, or in terms of the theme for Mental Health Month, looks at the issue of trauma. And trauma is one of the things that's kind of the silent underlining issue that we don't talk about as well.
Of course, because we don't want to air our dirty laundry,
Of
right?
course, of course.
But we still need to address it, specifically in the area of with children. I know that often with working with families, the issue of mental illness interferes with the delivery of instructional practices for the children. One of the areas that I'm noticing a lot, specifically among girls, is this issue about self-mutilation. Let's talk a little bit about that, because a lot of parents don't know what's going on with their children as it relates to that.
I think a lot of times when individuals, young boys and girls, are that teenager age where they're trying to redefine who they are, and that's based on your peers. That's based on what your community looks like, you know, what your family supports look like. And sometimes if you've experienced abuse, or if you experience neglect, a lot of children, especially young girls, they tend to go through self-mutilation of the way of coping with the issue of abuse. So when you see a child experiencing cutting their arms, marking their arms, there's an underlying factor. It's unseen, and that's where you have to call our teacher needs to call a health provider and say, I have someone in my class that's experiencing this. It's more than just them cutting themselves. It's a way of crying out. And so when individuals suffer from this, they say, you know what, I don't know why I'm doing this. I just don't like what I look like. I just don't like how I feel inside. And that's a way of them coping.
That's the way of them coping. Often we turn to medicine as a way of dealing with mental illnesses, and the community sometimes has mixed views on that. A lot of parents say to me, well, I don't want my child to be medicated, so as a result of that, I'm just going to deal with the child is just being rude. Because the parents often don't understand that the child might have a mental illness. How can we create a sense of awareness so that parents could get a better understanding in terms of what is this thing? What should I be looking for to find out if my child has a mental illness? Or if I have a family member, how do I know what this is? This person is just not acting the way so quote unquote normal people are supposed to act. What are some of the signs? What are some of the symptoms? What can we do?
I think it varies from individual to individual.
Okay.
But I think let's take as the case of young children.
Okay.
I think first of all, what you want to do is have a physical examination.
Okay.
There are a lot of other diagnoses which impact one's mental state, even in adults.
Right.
As in the case of someone's thyroid. Sometimes an individual may have issue with their thyroids, and because of that, they become severely depressed. And so a lot of times physicians tend to, before they put you on an antidepressant, they say, let me check your thyroid to see, because one of the symptoms of thyroidism is actually depression.
Okay.
So that's one way of looking at it, making sure the child actually, or the adult actually gets an actual physical examination.
So first we have to definitely get a physical.
You really do.
All right.
However, you look at other signs and symptoms. If in most cases, as the case of someone being depressed, because depression is very prevalent as a mental illness, and that's very important to understand what you look for. If someone is sleeping too much or not sleeping at all. If someone tends to lack interest in the things they do. If you have a teenager that tends to love sports and all of a sudden he's isolating, then there's an issue. If you see someone overeating, I don't mean those who love to eat anyway. I mean individuals who eat normally, but then now they're not eating at all or eating too much. That's a sign.
Okay.
Also, you want to look at who young people, who their friends.
Right.
Because your friends impact what you do. Do you stay out late? Do you break up curfews? All these things you look at. But there are signs and symptoms, and these signs and symptoms are something that we classified as health professionals, as you know, in the DSM-4 diagnostical manual, statistical manual, which we use as professionals to quote unquote diagnose someone. But you cannot just look at an individual, whether a child or an adult, and say, well, you have ADHD or you're depressed. It has to be clearly diagnosed by a practitioner. And once it's diagnosed, then the question is treatment. What do you do to treat the person? Do you put them medication first, or do you do therapy? And in most of the cases with young children, you want to look at the environment, give them a lot of supports first, a lot of therapy, chalk talk, a lot of love. Then you say, well, since these things are not working, now let's begin to look at the issue of medication. Because right now in the United States, there's a shift to looking at children who are overly medicated. And so Diane Sawyer at ABC News spent a lot of time last year highlighting that fact. And forcing the FDA to look at the issue of the overuse of medication for children in foster care. So we do have to be very careful with medication. I mean, they do serve a purpose. They remove symptoms and signs. However, you want to make sure that it's evidence-based.
All right. Well, stay tuned for more information. Don't change that dial because we need you. Bye-bye.
I am Dr. Lori Thompson. In my line of work as a mental health practitioner, I encourage others to be proactive in addressing their mental wellness. For Mental Health Month and throughout the year, First Lady Cecile DeYoung is encouraging all of us to learn more about mental health issues and to be aware of conditions that may be affecting you or your loved ones. Whether symptoms are temporary, everyday, or situational, there is great strength in seeking help, and there is pride in doing what is needed to have a healthy mind and body. Embarrassment or fear cannot be reasons to avoid needed medical care and treatment. Let's break the stigma and do the right thing in addressing mental illness like any other medical condition. Help a loved one to be strong and to get better.
I'm First Lady Cecile DeYoung. Join me and 10,000 Helpers of St. Croix, Clear Blue Sky, and St. Thomas in supporting those with mental illness through compassion, patience, and understanding. Be a friend.
That's what we came up with the show. Interesting people. We wanted to be one-on-one, conversation, not your traditional talk show. We really want to provide you with the real facts, the real talk, one-on-one.
United for Solutions, helping to produce television programming that informs and inspires the community to take action on social issues.
And we're back. We are removing the stigma of mental illnesses by learning and understanding what it is. So again, Dr. Victor, when we're looking at the stats in terms of mental illness, it's really alarming because we're just looking at it from a standpoint, oh, this is only here in the Virgin Islands, but globally. Let's talk about that.
Well, actually in 1995 to 2000, the World Health Organization collaborated with David Thatcher, which I so admire because he was the first Surgeon General to really look at mental health, not in isolation, but to look at its ability to impact other chronic diseases.
Correct.
And because of that, it brought awareness. The numbers which shows, and the statistics shows that as many as 450 million individuals in the world are impacted by mental illness.
That's a lot of people.
Yeah. And also in 100,000 population as ours, I would say about 17 of those individuals tend to be suicidal. And that's really high risk, especially in the teenage population in the United States.
I'm facing that right now. I have a case with probably about 5 young ladies that have been actually suicidal. And to me, it's as a practitioner, it's kind of scary because you know that they're in crisis. But the stigma, you try empowering the parents with the information, you make referrals for them to seek additional help in other places. Of course, we're not psychiatrists, so we're not authorized to induce medication, but yet still those barriers are always there for us to overcome.
I think the barriers are a lot of things. It's like knowledge, a lack of understanding what mental illness means, and then 2, being afraid that your child or even yourself maybe have a stigma, or your classmates may call you crazy.
Right.
And that's why a lot of individuals have a hard time going into the mental health clinic. We do have one in the Virgin Islands, the Barbara Plaza.
Right.
We have it in St. Croix, Charles Howard Complex. However, individuals are afraid of that stigma. And so one of the things that you want to do is, as a practitioner, to let the individual share what that is and what is the root cause of this suicidal thought. And usually there is. It's something that's underlying causes me to not want to be here anymore.
Exactly.
And once you do, there are questions you want to ask.
Give us examples so that we can bring that out there to the audience.
For example, if you tell me that you're suicidal, the first thing I'm going to ask you is, are you able to contract for safety? And contract for safety is a term that mental health practitioners use.
Right.
And it means that, for example, Ms. Burke, if you feel like hurting yourself, do you have a plan? And now the question is, you may say as a teenager, well, I don't know, I'm not sure. Well, okay, that's a good sign. You don't have a plan. If you have a plan, then I have to now commit you.
Right.
That takes it to the next level. If a young person or young adult says, even an adult says, I'm suicidal, I have a plan, I'm not going to share it with you. As a health practitioner or even a family member, you now have to step up to the next level, which is to now admit your child or your adult to the hospital.
I'm glad you brought that point
Voluntary
up,
commitment.
because there was a situation, I just attended a board meeting with people from the Roy Schneider Hospital. And one of the issues that came up was the fact that the hospital is not equipped to deal with adolescents and mental illnesses. When they decided to design the hospital in 1988, they never took into consideration that a separate aisle needed to be made for specifically treating adolescents with mental illnesses. So even from the entry point, when you come in with a crisis, really and truly you're just kind of put in there with everybody else. And it's unfortunate because we need to create systemic changes. That is not the way that it's normally done, because children, you can't treat those children the same way that you treat adults.
No.
And you know about that.
Right. And I think that that's based on the findings of the World Health Organization.
Okay.
Because basically, most places that are rural, and we are rural.
We are rural.
We do not have a lot of expertise. We don't have a lot of infrastructure. So we have to create it.
Right.
However, the hospital is indeed the safest place. Things just have to be built in to provide that level of safety.
Okay.
Because the reality is, it may not have been designed that way years ago. A lot of hospitals weren't designed that way a
Right.
little ago. But we have to now paradigm shift. How do I get to make my staff be more cognizant to manage individuals who come into the hospital who may or may become depressed or suicidal? Because don't forget now, a lot of other disease states like cancer, HIV, come with mental illness with it now.
Exactly.
So we just can't treat patients in two different ways anymore. We have to look at the patient as being complete.
Exactly. Now, there's an issue that I've come across that's really bothering me. Economic factor in mental illness.
Yes.
A lot of parents say to me, you know, I understand my child needs medication, but the truth of the matter is I have no medical insurance. Right now, because of the financial hardship that our territory is in, I cannot afford to spend $429 on medication. How do we shift parents from thinking that it's all about the dollars and cents as opposed to addressing the mental illness in their children?
Well, I think, and let's go back to your cost question. It's very costly for mental illness. Very costly. In the United States or in the world, $66 billion
Wow.
worldwide is towards this issue of mental illness. And don't forget, mental illness is not treated. About 60% of individuals are not treated with mental illness. So you can imagine a lot of people are walking around
Undiagnosed.
and undiagnosed.
Exactly.
And not receiving treatment. And I say, well, yes, medication is costly. And because of that, one needs to think about doing a lot of preventative work.
Okay.
Spending time with your children.
Right.
Not putting them in front of a Game Boy or Xbox. Going out and doing outings. When I grew up here in the Virgin Islands, every Saturday, all of us hanged out on the beach.
Right.
All of us got to know each other from the various different schools. I don't see that now.
Right.
A lot of children or young adults or even teenagers, they stay in their little cubbyhole. They come out every so often and you see them, like neighbors, but there's no integration of them with their friends and their community. And that's one step. Empowering them to be more interactive with their community, volunteerism, you know, seeing what interests them,
Okay.
you know, what do they like to do. Get them to look at their health in a different way.
In a different
In a different way. Because you are what you feel, you are what you think. And be more involved with them. Not just say, okay, you do this, and I'm gonna go do my thing. And that's part of it, reason why parents need a lot of education, because a lot of parents want to do their thing, and their children are left unattended, and that's why we have Facebook. And we have Twitter, and we have all these things happening, and there's no one guarding them,
Right.
no one protecting them.
Right.
And I think that that's one of the things. Medication is expensive, and if it's needed, it's needed.
Right.
Because what do you say to a parent that your medication for ADHD, Concerta, or any of those stimulants is $300 a month,
Right.
or $200 a month? That's a lot. Even for the pharmacy telling the parent who don't have insurance. And I know a parent right now who's going through that, where her son is at Antilles doing very well academically, plays chess, do everything fabulously. However, he was put on medication years ago.
Right.
And the question is, does he still need that? And that's something we have to go back and say, make sure when you put children on medication, or even adults, you continue to do what? To evaluate them. Their signs, their symptoms,
That's
and
correct.
how they're improving.
Okay, let's talk about that, the signs and the symptoms for parents.
Yes.
If I'm a parent and I don't know, sometimes I might think, oh, the child is just being rude. But then again, maybe he's bipolar, maybe he's schizophrenic. Right? How do we make that distinction? What kind of mental illness this child or this adult is facing? What are some of the signs? I know anxiety, we talked about schizophrenia, we talked about bipolarism. How do we distinguish among those?
I think it varies, because don't forget, if you're bipolar, it's basically your mood states.
Okay.
If you're schizophrenic, it has to do with your reality. Are you here? Do you know that you're in school? I mean, there are different things you look for.
Okay.
Are you hearing voices? Are you seeing things? Are you
Right.
delusional? There are different things. If you're depressed, are you isolating? Now, we haven't talked about substance abuse,
Right.
which is part of mental illness as well. Are you hanging out? What are you doing? Are you drinking while I'm not looking?
Right.
Are you smoking marijuana? Because a lot of young teenagers are into marijuana, and it's a very
Right.
high prevalent rate in the United States as well.
Exactly.
So we look at these signs to see what, and then once we know something is wrong, we seek you out. We seek the professional out. We ask questions. We go to their primary care doctor, their pediatrician, and say, I need a health workup.
Okay.
My son or my daughter seem there may be an issue.
Okay.
And then I think that there's other issues, and then you say, okay, and they refer that person to a psychiatrist, and the person gets tested to a psychologist
Okay.
to make sure the child indeed, because a lot of children are diagnosed, but then a year or two later, the drug comes off, the child is 4.0 student.
Right.
So you have to go back to the baseline.
All right. When we get back, we'll get more information on mental illness with Dr. Victor. Stay tuned.
I'm Doris Farrington Hepburn, Director of the Division of Mental Health. We all probably know someone with a mental health condition, whether depression, anxiety, eating disorders, or phobias. In fact, an estimated 58 million Americans suffer from a diagnosable mental disorder, or 1 in every 4. Oftentimes, one's mental health suffers when symptoms are denied and when medical attention is not prioritized. People can often benefit from medication, rehabilitation, psychotherapy, or self-help. But if we truly want to be a healthy society, we need to break the stigma and treat mental illness like any other medical condition. It starts with us. Help make a difference in a loved one's mental health.
I'm First Lady Cecilia DeYoung. Join me and 10,000 helpers of St. Croix, Clear Blue Sky, and St. Thomas in supporting those with mental illness through compassion, patience, and understanding. Be a friend.
That's what we came up with the show. Interesting people. We wanted to be one-on-one, conversation, not your traditional talk show. We really want to provide you with the real facts, the real talk, one-on-one.
United for Solutions, helping to produce television programming that informs and inspires the community to take action on social issues.
Thank you for tuning in on One-on-One. Dr. Victor, let's talk about the issue in terms of funding for mental health services. Where does one get funding for these mental illnesses and how we can treat them?
Actually, in terms of funding, about $60 billion or more comes from the federal government.
Okay.
That shift it used to be where the state and local had money in the 80s. And because of the shifting of where the world has moved, most of the money comes from SAMHSA, which is the Center of Substance Abuse and Health Administration.
Okay.
Of that percentage, then you have private insurance. Okay, so those who have private insurance, Stigma, Aetna, all those things, excellent. Then a percentage comes from Medicaid.
Okay.
Those who are basically disabled. Some from Medicare, because you have seniors who have Alzheimer's, dementia,
Right,
those 65 years and older.
That's another
That's
issue.
another
That's another
issue.
show
That's
within
another
itself.
That's a show.
That's another show within
And so
itself.
all these, and also the VA, the Veteran Administration, veterans, vets are allowed to get funding. So all of this comes, it's very expensive. However, one thing you want to make sure that we know is that 4% of the gross national product of the whole world, the United States especially, comes from mental health illness and substance abuse.
Okay.
And so the cost is there. So what does the World Health Organization say in 2001? Be similar to what we say today. There's a call for action. We need to look at prevention. Prevention is key.
Okay, let's talk about those preventative measures. If I am a mom and I'm expecting, what should be some of my preventative measures to make sure that I myself have mental wellness and that my fetus, my baby is also, because sometimes we understand that mental illness is genetics. How do we go about that?
I think the first thing you want to do if you're expecting mom is to get a physical examination.
Okay.
Talk to your OBGYN doctor to look at and see whether you're high risk or not. A lot of them when you're high risk, it causes depression. And to see whether or not this is your first child or not.
Okay.
And a lot of times when you do that, even including a nurse practitioner as well, they look at your health, they look at your overall health and your diet. Nutrition is key.
Okay.
They put you in supplements and vitamins to make sure that everything for that delivery is well.
Okay.
Now, if you have a lot of stressors, you want to look at what are your family supports, what are your social supports, who is going to keep an eye on this baby. If you're married, we have a lot of parents who are single parents who take care of children on their own. There's a lot of stressors right there.
Right there.
So knowing what you're about, your social, emotional, and your overall well-being as it relates to taking care of this child is looking for that and reaching out, asking questions, eating healthy, drinking water, exercising. All these things promote wellness.
Okay.
We talked about wellness before.
Right.
That's one thing preventative in terms of prenatal.
Okay. Now let's talk about this take to action. We need to make a difference.
Yes.
So how is it that we can create this sense of urgency for our parents to say, put those, and for the members of our community, put those stigmas aside. We have services right here that can be able to be used to address this mental illness. We know that it's an issue in our community that is not going to go away. If you had diabetes, you would go for treatment. If you have high blood pressure, you would go for treatment. But you have mental illness. Oh, let's not go for treatment. Let's just pretend like it doesn't exist. We want to encourage the community to please reach out and get treatment.
I think one of the things that the theme for National Health Month is take action, and 1 in 4. So if 1 in 4 individuals or 1 in 4 families, someone in that family has a mental illness, understanding your family history is key. Does it run in my family?
Right.
Does depression run in my family?
Right.
Schizophrenia, what it runs in my family, and then what is preventative?
That's why genograms are so important.
Very. Just like diabetes, similar.
Right.
And also, what you can do is look at your diet. In China and the other part of the world, they look at doing Tai Chi, yoga, relaxation, meditation. All these things promote good,
Mental wellness.
Mental wellness,
Right.
okay? A lot of endorphins. We need that good energy. We need to feel good. And that promotes that. Also, the World Health says for teenagers, empowering them, teaching them about substance abuse, teaching them what the consequence of using is, the consequence of bullying, the consequence of not loving who they are.
Right.
Do you know your family history? Do you understand your culture? That promotes wellness.
Absolutely.
On the back end, health. Making sure you get your physical, males and females. If there's cancer running in your family, do you smoke? All these things promote wellness, promote you having an overall good mental state. And last but not least, those providers who work in our community, we have a small community, be more interconnected. Share with each other, because you may know a counselor, you may know someone that can help. And so that's one of the things we can do. But most important of all, love someone, reach out to them, hug someone, say you're sorry.
Right.
Things like that. Those things promote positivity in our community. And don't feel bad when you feel blue. Don't feel depressed
like
when you
that.
feel down. That's part of life.
Right.
When you don't feel well, reach out to someone and say, I'm not quite having a good day.
Right.
And then if you really need help because you're not eating, you're not sleeping, you seem anxious, you seem stressed out, then we seek Dr. Celia Victor, Miss Cira Burke, anyone in the community that can guide us. And the goal is for us to be more interconnected as providers. We cannot do it anymore. We cannot just say it's a mental health problem. It's their problem. It's our problem.
It's our problem.
Take it back. It's our call to action.
It's our call to action. And we're calling you to action.
Yes.
Dr. Victor, thank you so much for sharing with us on One-on-One. I think that we've shared information that is going to be useful to our community. We are calling you to action. Mental illness is definitely an issue that is affecting many people in our community. We don't want to push it aside. We understand that there's a need to service everyone. Again, the call is to action. 1 out of 4 family members are affected by mental illness. The research shows that we need to deal with it once and for all. We thank you for tuning in to One-on-One, and we hope the information that was shared with you today was an insightful one. We thank you.
United for Solutions, helping to produce television programming that informs and inspires the community to take action on social issues.